All right, so for starters, so this is a 6 millimeter spot size. And let me take you back to the machine. And so what we're changing on this machine, we can actually use 650 microseconds, or we can actually use 1.5 milliseconds. But I'm going to focus in on the microsecond domain. We can change energy modes. Each energy mode corresponds to a particular fluence. So with this spot size of 6 millimeters, energy mode of 6 is 21 joules per centimeter squared. And then I can change up and down how fast I want it to fire. So it's fairly simple. So what I do is I use the 6 millimeter spot size first to cover the broad area, you know, where they have flushing, where they have erythema and redness. And then I'll get to a smaller spot size when I treat some of the smaller telangiectasias. So we are ready to go. And so I'm using it pretty slowly. I can go much faster if I want, but I want you to see it. And you can see she's not budging. Of course, we've tied her down, but she's really not moving at all.
Dr. Goldberg, do you find this faster than using the KTP? It looks, because it's such a large spot size, it looks like you get your treatment done much faster.
Let's go over here. If you're asking me a question, I don't hear it, David.
Oh, sorry. One of the things is that...
So what's happening even with this larger spot size, some of the vessels are vasoconstricting. She's also got some photo damage, some pigment that's going to help that as well. And so I'll go over her nose and her cheek. And once I've done this, I'll now change the tip. And I'm going to put on the 2 millimeter spot size. So I'm just changing from that white tip to the red one, which is the 2 millimeter spot size. There's also a 3 millimeter spot size. And now leaving it the way I had it before, which is energy mode 6, I'm now up to 191 joules per centimeter squared. And so now I go after the well-defined vessels, which you can see here. And you should see some vasoconstriction as I'm hitting them. So she obviously feels it a little bit, but not a lot. Remember, there's no numbing cream here at all. And I think you can see those vessels constricting. At least we can see it here. So if I want to, I can really speed it up. And so you see how you can go over the whole face very quickly. But it's the safety of a microsecond domain Nd:YAG laser.
Oh, the picture went out. There we go.
And that's it. So that's her treatment. Okay, we're going to start treatment number 2. We're treating at 21 joules.
Any other questions?
What's the question?
She's asking about surgical scars.
If they're red, you can treat them. With a 6 millimeter spot size with this, you could easily treat poikiloderma. Mm-hmm. You could treat hypertrophic scars that are not terribly thickened. I mean, anything that you're going to use, you have to think of this Nd:YAG laser as being different than other Nd:YAG lasers. Anything you can treat an IPL with, you can treat this with. And that's because it's the microsecond domain and not the millisecond domain. You know, I'm not going to use this to treat children's port wine stains, but pretty much everything else on your list, poikiloderma, erythematous scars, hypertrophic scars, rosacea, telangiectasias, with this 6 millimeter spot size and essentially painting the area, you can do the same thing. Okay, we're going to start treatment number 2. Okay, I'm going to start treating here.
Okay. I haven't done that, but I know there was a recent, they did a recent comparison. Right. I saw a lecture on it, and IPL wasn't as effective as pulse dye or KTP for bruising.
We're treating at 21 joules per centimeter squared again. 6 millimeter spot size. And I want you to see the essentially the laser itself. I mean, it's very lightweight. I don't have to have any contact with the skin. I don't need contact cooling because it's not a millisecond pulse system. And the system itself is air-cooled. So broad strokes over the entire face of the areas I'm treating. And then I'll focus in on the well-defined telangiectasias with the smaller spot size.
Anyone have any questions about this technique?
Okay, we're about to switch over to the 2 millimeter tip.
It's the cooling system. Dr. Goldberg, that's air cooling?
That's air cooling. You hear the sound, and then it shuts off. Once I take my foot off the pedal, after, I don't know, probably about a minute or so, it shuts off. So it is shut off again. And as soon as I hit the foot pedal, it'll kick in again. All right, so now, let's see. She's got some well-defined telangiectasias on her nose and a little bit on her cheek here. So I'm going to start here first. So we're back now to that 2 millimeter spot size, 191 joules per centimeter squared. And again, she's got no numbing cream on at all, 0. And for any of you who have used Nd:YAG lasers in the millisecond domain for hair removal, you know they hurt. She's getting some constriction of these vessels. She has a little scar here. Was that a skin cancer at some point? Yeah, so she's got some telangiectasias over it. We'll hit those. Okay. In Florida, when you see someone fair-complected and they have a white spot on their face, you can be pretty certain it's skin cancer or pre-skin cancers.
Oh, that's Dr. Goldberg. Okay. Dr. Goldberg?
Okay, what's the question?
We have a volunteer here who has a bruise and was wondering if, and I've never used it, but can you use the 6 millimeter on her bruise?
Yes, I would use the 6 millimeter. I use the lower fluent 6 millimeter spot size. Because,
she was wondering if she could go back there.
I mean, it's the same concept behind why a KTP laser, IPL, pulse dye laser are going to work for bruising. It would apply to this system as well. Here we go. Let's go over here.
If you go behind there. Yeah, and just tell them. Yeah. She's really tolerating this well. Most of you have done old-fashioned 1064. This can be very painful.
So she's got some lentigines here too, and I'm going to treat them as well. And she'll get some absorption of the melanin by the Nd:YAG 1064 wavelength. And like I said, you can use this for skin toning. Usually, though, I'll use the larger spot size for that. And that's it.
With this, I don't see why not. Yeah, I think. Bad, right? But if you're in the orbit, you might have to use shields. But yes, I don't see why. But let me ask, Dr. Goldberg.
Yes, I'm.
What about periorbital veins?
Oh, we have a bruise here. I'm going to treat it. Yeah. All right, come on down. Come on down. All right, you can sit on the table here and show your bruise. All right, we're back, everybody. Okay, we're going to improvise here a little bit.
Dr. Goldberg,
there's goggles on. Melanie, can you put goggles on her, please? So
Dr. Goldberg?
Yeah, Michelle will put those in. I hear you.
There's a question from the audience. Can you use this to treat periorbital veins like the reticular veins?
Yes, but I would generally, in that case, I'd use the 1.5 millisecond pulse.
Okay.
Okay. Because those are much more difficult to treat with any laser. All right, so I want you to see this bruise. And I also want to make it perfectly clear she's not one of the people I injected yesterday. Let's just be clear on that.
It was for me. I injected myself.
She injected herself. Oh, my God, the cardinal sin. All right.
I have some magic pages.
Oh, she's going for it. All right, let's see. Lift your head up for a second. All right. So where's that bruise? It's now hidden. Oh, there it is. Okay, good. Okay, so again, back to the 6 millimeter spot size, low fluence, she's hardly going to feel it. And it's not like the purpura disappears on impact. What it does is it'll go away in a day or two, relative to usually taking, a week to 10 days. So, okay. So I've got a frequency of 1 hertz, 21 joules per centimeter squared, 650 microsecond pulse, 6 millimeter spot size, and here we go.
You can actually see a little bit of lightning. I don't know if you saw that right away already.
All right, and since she's really going for it, we're going to treat the telangiectasias too. Yeah. Talk about getting yourself into the system. All right. Are we doing what else are we treating you on? Let's see, what else can we treat on her today? All right, let me just get this tip in. And then I'm going to come out and take a couple of questions, so hang in there, guys.
I used retinol last night. If that makes sense.
It won't matter, yeah. She's got a couple little telangiectasias we'll treat. Yeah, that's fine. Just wipe a little bit too. You do, yeah. I don't see much.
So any questions regarding this device?
Just let it dry for a second. Hang in there for a second.
Yeah, with an IPL KTP. I don't see why you couldn't, though. Like I said.
So again, we're back to that 2 millimeter spot size. Let's see what you got here. Done. That's all it is.
I have a question. Periocular.
Right, so someone asked that. So it could be used, but I would use the longer pulse duration. Yeah.